Good morning, Peter Goertz. I'm a psychiatrist. Can being a doctor be stressful? Of course, just like any other job, cashier, etc. It can be stressful, but the stress or potential stress can definitely be modified. And one key thing to me is, as much as possible, to get out of your head, even at work. So you want to feel your body, you want to focus on your breathing to balance all the thoughts that may be circulating in your mind, and those thoughts can lead to anxiety and potential stress. So a basic thing that can minimize stress is to make sure you're in the right job. So if you enjoy administrative work and you're working as a clinician, seeing patients all day, that's not going to be the right thing for you. And vice versa, the same thing. If you're interested in clinical work and working most of the time as an administrator, that's not going to work for you either. So that's a very basic thing. Have the courage to trust your feelings and get whatever job feels right to you. And the minimization of stress can start with commuting, with even while you're getting ready at home. So you want to focus, again, as much as possible on your body, on your breathing, instead of having all those thoughts circulating while you're driving. This guy cut me off. You don't want that type of potential stress on your way to work, for instance. And you can check it out for yourself. When you sit down at work, you turn on the computer, start checking your emails or messages in your computer system, whichever one you use at work. And you're going to see maybe after a weekend on a Monday morning, 20 emails, 10 messages in the computer system about patients, maybe even one or two of them with a red flag. And potentially, you're going to get into a state of stress right away. So even maybe before you start the computer, remind yourself, get out of your head, be in your body, focus on your breathing, feel how your body feels, and minimize all those circulating thoughts that can lead to, or potentially lead to anxiety. Now, being a doctor, like many jobs, has a lot of responsibility, and that in itself is something that for some people can be quite stressful, for anyone maybe at times. And one basic thing to realize regarding the responsibility is that we all make mistakes. So you definitely want to look at yourself in the mirror and express to yourself that you realize that you make mistakes every day. You want to accept that, embrace that. We're human. So once you do that, that already can decrease potential stress. Just accepting the fact that we're all human, we all make mistakes. Any doctor at some point may have a bad outcome. A patient may die. Someone may commit suicide. So there are many things which are not in our control, and that's another thing to remind ourselves of. One thing that can definitely get in the way of enjoying our day are emotions like anger, being annoyed by either patients or staff. And one example from my internship was, it was the middle of the night. I was tired, it had been a busy day and night, and I just wanted to get to bed and maybe get half an hour of sleep or a little bit of sleep. And I was trying to tell the nurse something about a medication of a patient in the emergency room, and she was just ignoring me. I tried to let her know. I thought the dose of the medicine might be a little high. She just ignored me. I tried to get her to change that dose in the system. And sure enough, then, I got so frustrated, I just gave up, laid down for a little while, and sure enough, in the morning, that patient was overly sedated, and that's unfortunate. So in that case, my own negative emotions, the anger, directly had a negative impact on the care of the patient. So we want to be very careful and keep tabs and feel our emotions. We don't want to be disconnected from them, whether it's emotions regarding patients or staff members we work with. And you're going to be tested. A patient may call your office 5 times a day and want you to call her back each time. And that, of course, can bring up pretty intense emotions in you, especially the fifth time. So you want to back up, get into a grounded place before you start that telephone call, because if you lose your temper, then the entire interaction is going to be affected by that and likely will have at least some negative aspects. And in fact, I'm remembering an older psychiatrist in a hospital I used to work with, and he told me the only 2 times he ever was assaulted was when he lost his own temper with a patient. So it kind of can be like an infection, carry over our own emotions, can infect other people. Something like anger, for instance. And again, he felt the only reason he'd been hit twice was because he lost his own temper over the years, twice, which is pretty rarely for decades of work. But still, those are the only 2 times when he'd been assaulted by a patient. You want to be efficient. Saving time definitely can create a more relaxed work day. You want to minimize the time you spend on bureaucracy. You want to write concise notes, not overly wordy notes. Everyone has their own style, but the more concise, the more time you spend, the less time you spend writing the notes, and the more time you have for the clinical care of the patient, and the more time you have to enjoy your day. My experience is, at least for me, what works best is focus on one thing at a time. So so-called multitasking does not work for me. You just get distracted, you miss things. So if you get interrupted by a phone call, deal with that phone call. Don't go back and forth between what you're doing and the phone call, as an example. Boundaries are important. If you set boundaries, that's going to help you enjoy your day, not to have your time used inordinately by patients, for instance. Let's say a patient's late for their appointment and they expect you to extend the appointment into the time that already is booked for another patient. In general, you probably don't want to do that, because then you'll end up, at least potentially, staying quite late that day. So setting boundaries with patients and staff members is important. So my general practice is to, as much as possible, be on time when I start appointments with patients, within 3 to 5 minutes. And that way they know that if they're late, you're not going to extend the appointment, but if they're on time, you're going to see them on time. So that seems fair to me, and the patients in general are okay with that, since they know that you're pretty much on time. They do not expect me then to extend my appointments. Another thing, of course, that can help with you enjoying your day and minimizing potential stress is humor. So you want to have fun in your interactions with patients and with staff. Thank you.